morning, everybody.
Good morning.
Can you hear me in the back? Way back there, can you hear me? Do I see the heads nodding? Good. I want to make sure. First of all, I'm really delighted to be here at Health Watch USA. Thank you to Dr. Kavanaugh and all the board members and volunteers of Health Watch USA. I think it's so important these days in healthcare that we have all of us who are stakeholders coming together to have these kinds of conversations about what's going on and what each of us can do, whether you're physicians, nurses, administrators, patients, or family members. These are the kinds of conversations we desperately need to make healthcare better and safer for all of us, whether we take care of patients or whether we are patients, and we all are patients at some point in time. I'm here today to talk about a topic that is gaining increasing frequency in healthcare today, and that is overuse. And it's kind of odd to talk about overuse at a time when we still have, although healthcare reform is changing that, millions of Americans who don't have access to healthcare. As we know, there's 3 different types of healthcare quality issues in the United States. We have underuse, where people don't get the care they need. We have overuse, where people getting care that actually can cause more harm than good. And then we have misuse, and those are errors and infections and things that shouldn't happen. And you'll see all 3 of these themes are coming through at this conference today. You know, one way to think about overuse, it's sort of how we deal with food. You know, we have pockets of malnutrition, perhaps not far from here. And yet we have pockets of where people are eating too much and pockets of obesity. At the same time, we have pockets in healthcare where people can't get the care they need. At the same time, we have pockets where people are getting too much care, and I'll give you some examples of that's taking place in America all across the country. And so we have this dynamic of underuse and misuse and overuse, and I'm getting that feedback for some reason. Maybe these are too close together. Did that work? Look, magic. So we have this dynamic between underuse and overuse, and how do we get it right so people get the care they need and not the care they don't? So let's get started. I'd like to do a couple of things in the 40 minutes we have today. Discuss overuse of medical care, highlight why addressing overuse is so important, not just for Medicare but for all of us, talk about some public policies to address overuse that affect Medicare and other parts of healthcare, and finally, what can you do to protect yourself? You know, we've talked about a lot of the challenges in healthcare today, but you know, over the past 2 weeks, if you've been watching what's going on as a result of Hurricane Sandy in New York, New Jersey area where I grew up, we've had extraordinary examples of the best of medicine and the best of nursing. I'm sure many of you saw this on television with the evacuation of NYU Hospital and what the nurses and physicians and everybody else in healthcare were doing. Just extraordinary examples of what all of you who work in healthcare do every single day in quiet ways. And this taking patients down flights of stairs to get them to safe places when the electricity went out. Earlier this week I was talking with a senior vice president of nursing at one of the hospitals in the New York area, and her job was to keep the generators, make sure the generators were going so the patients could have good care and not be harmed by those terrible events in the weather. So we do so much good in healthcare every single day, but we have enormous challenges. Some of you might have seen reference to this in some of the newspapers here in Kentucky. The Institute of Medicine in September of 2012 came out with a report acknowledging that 30% of the money that we spend on health care is wasted. It does not add value to people's health. And the total cost of that was $750 billion. How much is $750 billion? Well, the cost of insuring all the 32 million uninsured who will be insured with health care reform each year will cost only $250 billion. So we could pay for the uninsured for 3 years for the $750 billion that we're wasting. And as you'll hear, as we have, boy, this is really singing here today. How about if I put it on the other side? Let's try that. That's an enormous sum of money, and as healthcare is becoming more and more expensive, we don't have that money to waste. If you've seen this article in the New York Times, HCA discloses the U.S. inquiry into cardiology services. The New York Times got a hold of internal documents reporting on overuse of interventional cardiology services. I'll just read it for those of you who are in the back. The first couple lines of this New York Times article that came out in August. HCA's stock fell about 4% Monday after the company disclosed that the cardiology practices at some of its Florida operations were under scrutiny by the Department of Justice. And now the Department of Justice is investigating. They've been contacted. They've contacted some of the hospitals in HCA seeking information about the medical necessity of interventional cardiology services. The year prior, the U.S. Senate investigated a hospital not too far from where I live in Towson, Maryland, for performing stents on 583 patients who did not have any blockages and whose condition did not warrant stent placement. This also made the front page of the major newspapers. And here, closer to home, in a local newspaper, claims of unnecessary heart procedures. So we're seeing this issue of overuse pop up more and more in American healthcare. And what does it mean for patients? And what does it mean for how we can have a sustainable system if overuse keeps going up? That's the overuse. And by the way, we had a great discussion or a great presentation this morning on measurement in healthcare and value-based purchasing. We don't really have measures of overuse. So when is a hospital overusing cardiac procedures? We don't have measures of that. Not yet. Back in September, the Joint Commission, which accredits the nation's hospitals, and the American Medical Association came together, and this is a bellwether event, ladies and gentlemen. For the first time, we had a national summit on overuse. We've pulled back the curtain, and the conversation was honest and open. Here we have this problem of overuse at a time when we have so much underuse. How are we going to begin to reduce it? And let's be clear, this is a controversial topic. Unlike errors, when we have overuse, it draws in revenue. And when you're talking about overuse, how do you pull back on that revenue? And the only way that I've been talking about it is not about a money issue, but it really is an extraordinary patient safety issue. The fact that we're performing procedures on people when it's not warranted and exposes them to more risk than they should ever be exposed to is something that really demands our attention. I'd like to turn for a minute to another aspect of what the Institute of Medicine talked about. We have overuse of unnecessary medically inappropriate procedures, but we also have tons of waste. And here's an example of that. I had the pleasure of meeting a wonderful pediatric neurosurgeon who works at a hospital in the Midwest. And he heard a talk in Washington a number of months ago. And it was a group of physicians, and they were encouraged to go home and be good stewards of medical resources. So he went back home and he asked his CFO if he could have an indication of the supplies that were in his operating room and how much they cost. As a surgeon, he said he never knew really what was in that supply cabinet and how much they cost. And it was extraordinary what he found. In one pediatric neurosurgery OR, there was $700,000 worth of supplies. As they went through them, 10% had expired. He concluded of that $700,000, only $295,000 was actually needed. So $400,000 in excess in one operating room in the United States. He looked at the sutures and said, you know those sutures? They're more expensive. We can use these other sutures, and I would save the hospital $35,000 a year. No negative impact at all on patient outcomes. So then he went to the CEO of the health system and said, gee, we have a great opportunity here to save lots of money. And this is money that the hospital gets to keep. You know, we're hearing how much pressure hospitals are under to save money. Well, here's an opportunity for them, he thought, where they could save lots of money. And they calculated over several years the hospital could save, $1 billion. Again, that would be money that they could keep. But as you go up the food chain and you see how it's hard for hospitals to do the kinds of purchasing, the smart purchasing, because of how healthcare is organized with the group purchasing organizations. And I don't want to get into all of that because it's complicated. But the system is geared to spend more and to increase volume. And that's what leads to so much waste. I saw the pediatric neurosurgeon a couple weeks ago, and I said, gee, how's it going on your quest? And he says, you know, I'm hitting a ceiling because it's really hard to change this. He wanted to buy a simple piece of ultrasound equipment, and he was shocked at how much it would cost if he went through the traditional route. He went through a non-traditional route and on his own found that he could purchase the same piece of equipment for 10% of the cost of what the hospital would have to pay for it. So we have enormous amounts of waste in healthcare that's not adding value. And we'll talk more about this later. Meanwhile, the whole Medicare... I'm sorry about that feedback. Move this one down? This one. How's that? Shall we try that?
Actually, let's move your mic down a little bit too. I think it's getting some feedback from you.
Thank you.
Let's see.
So, all that waste that we have in healthcare, enormous amounts of money. And what's our dialogue that we're having about Medicare and healthcare generally? It's about, you know, should we be raising the Medicare eligibility age, cutting back benefits, raising premiums? There's a third way here, ladies and gentlemen, that I hope we can add to our dialogue. We'll talk more about this later. So that's the overuse and the waste. As I started digging through this, and I wrote a book on overtreatment called The Treatment Trap, and last year when I was at the Health Watch USA conference, I had the privilege and pleasure of talking about that. Since then, I've sort of been drilling down and digging, well, what is driving the overuse? What is driving the waste? And if you go back to what President Calvin Coolidge said about America, the business of America is business. And when it comes to healthcare, which has such a huge footprint on our economy, it turns out the business of healthcare really is about business. I was at a meeting in Chicago with a group of physicians earlier this week, and this is a bellwether sign, ladies and gentlemen, of where healthcare in America is headed. He described how there was a group of primary care practices in southern Florida, and those practices were sold for $350 million not long ago. And guess who the purchaser was? Goldman Sachs. Another physician described, he's an anesthesiologist, how anesthesia practices now are being purchased by for-profit companies. And so now the anesthesiologist will be working for directly a for-profit company, not a hospital. We heard Dr. Kavanaugh talk about the trend toward hospitals employing physicians. But we're seeing in these other aspects of healthcare now, corporations buying up these practices, at least in the field of anesthesiology. And there's also interest by private equity firms to getting in, to buying up and investing in those businesses. This is a whole new arena in healthcare today. And I wrote about it in this book, The Battle Over Healthcare, to begin to uncover what is really going on and what the manifestation is that we see as patients